Hi, my name is Emma, and this is my informative speech on sonography. Imagine being able to see a growth of a baby, a beating heart, or maybe even another internal organ in real time without having to use surgery. Well, that's what sonography is. Whether you've seen an ultrasound image or know someone who has benefited from one, it is a major part of the diagnostic medical field. With the medical field always advancing, especially in the imaging department, sonography has become one of the most versatile and essential tools in diagnostic healthcare. Some of the main points I'll be going over is what is sonography and how does it work, its applications in the medical diagnostics, and career opportunities and benefits of being a sonographer. What is sonography and how does it work? Well, sonography is also known as ultrasound or ultrasound imaging. It uses sound waves to produce images of structures inside the body. How it works is that there is a wand called a transducer, and this transducer emits very high frequency sound waves that have to at least be over 20,000 hertz to produce an image. These high frequency waves bounce off of tissues and organs and creates echoes that are transformed into visual images by computers. There are many advantages to sonography, and some of the main ones that a lot of people care about is that it's non-invasive and it's a very painless procedure. So you don't have to get poked and prodded by needles or be thrown into a tiny little tube and sit there for an hour while you get an image taken. There's also no radiation or exposure involved, unlike x-rays or CT scans. There are many different fields that involve sonography and applications it applies to. One of the main ones that a lot of people think of is babies, so obstetrics and gynecology. Ultrasound is used a lot to monitor fetal development and detect complications during pregnancy. It also can help diagnose endometriosis and help with the placement of an intrauterine device, which is also known as an IUD. Another field that it helps in is cardiology. They do echocardiograms to assess heart function, and it also can help detect heart abnormalities. It also can be used to assist with a more invasive procedure called a pericardiocentesis, which is a procedure performed to remove fluid around the heart. Then there's also abdominal and pelvic imaging. This is used to diagnose a lot of issues with organs like the liver, kidneys, or even the bladder. Some examples might be cirrhosis, hepatitis, biliary issues, gallstones, or polycystic kidney disease. The last one is musculoskeletal imaging. This examines muscles, tendons, and joints for things like injuries and soft tissue tumors, or even possibly rheumatoid arthritis. There are many career opportunities and education and training that goes into being a sonographer. Sonographers are trained professionals who operate the ultrasound machine, and they interpret images for the physicians so the physicians can talk to the patient and see what's going on. They're trained in many different fields of ultrasound so they can differentiate types of pathology. There's also different types of education and training that they go through. There's different options as well. You can either obtain a certificate, an associate's degree, or even a bachelor's degree. Most colleges offer a associate's degree, but then you can work your way up to a bachelor's degree because they offer some type of extension. As a sonographer, it is a very high demand job because of the growing healthcare industry. It has a very competitive salary and opportunity in specializations. And also in the state of Virginia, you can make up to over 6 figures a year, which is great. And there's also the job satisfaction that comes with being a sonographer, and it has the ability to contribute to patient care and outcomes and being able to help patients in other ways that other people might not be able to. So sonography is a very safe and vital imaging technology. There are many applications, and it's very diverse from monitoring pregnancies to diagnosing heart conditions. And the career of a sonographer also offers personal and professional fulfillment. Sonography is not just about imaging, it's also about being able to take care of patients and providing them with more answers and helping them in different ways. And as technology advances, so will the impact of sonography.